Clavicle. Clavicle is also called beauty bone or collarbone. Now why it is called beauty bone? Because it enhances the external beauty of human. Clavicle also has got some unique features. Clavicle is the first bone in which ossification is started, and also it is the last bone in which ossification is completed. What it means? It means that clavicle is the only bone which has got the longest ossification period. Clavicle has no medullary cavity. As to some extent, medullary cavity provides cushion-like support to the bone. Now, as clavicle has no medullary cavity, then it means that clavicle can be fractured easily. That's why clavicle is the most commonly fractured bone. Clavicle lies horizontally. Clavicle, although it is long bone, but it undergoes intramembranous ossification, while all other long bones undergoes endochondral ossification. We have divided the whole clavicle into two main regions, that is medial 2/3 and lateral 1/3. Medial 2/3 lies close to the median plane, while the lateral 1/3 lies close to the lateral side. Now, why we say medial 2/3 or lateral 1/3? Why 1/3 or 2/3? Because if we divide the whole clavicle into three parts, then of those three parts, two parts will be occupied by the medial region. So we say that medial 2/3. While of those three parts, one part will be occupied by the lateral region. So we say that lateral 1/3. Now, as you can see that medial 2/3 is convex on the anterior side. As it is anterior view, it is convex on the anterior side. So we say that medial 2/3 is anterior convex. While on the other hand, lateral 1/3 is posterior convex, as it is convex on the posterior side. Also, you can see here that the medial 2/3 has four surfaces. That is quadrilateral, mean four sides. That it has four borders and four surfaces. So this one is anterior surface of medial 2/3. This one is superior surface of medial 2/3. Similarly, it is posterior surface of medial 2/3. In the same way, it is inferior surface of medial 2/3. While on the lateral side, it looks like flat, which means it has two borders and two surfaces. That is anterior border and posterior border, and two surfaces, that is superior surface and inferior surface. As we have discussed in our previous animation, that clavicle has got two main regions, that is medial 2/3 and lateral 1/3. Medial 2/3 is anterior convex and lateral 1/3 is posterior convex. This is the clavicle bone, which we have seen in detail in previous animation. Similarly, the anterior convex has four surfaces and four borders. Medial 2/3 has four surfaces and four borders. So we call it that it is quadrilateral end of the clavicle. On the other hand, posterior convex has two surfaces, that is superior and inferior, and two borders, that is anterior and posterior. So we say that posterior convex or lateral 1/3 part of the clavicle is flat. Clavicle has got two ends. Just focus on the pink color. The part of the clavicle bone indicated by the pink color is the acromion end, while it is the body of clavicle. The part of the clavicle indicated by the pink color is the body of clavicle, while this one is the sternal end of the clavicle bone. As we have discussed previously, that clavicle has two ends, one lateral end or acromial end, which forms acromioclavicular joint, mean joint between clavicle bone and acromion process of scapula. Second end is called medial end or sternal end, which forms sternoclavicular joint, mean joint between sternal end of the clavicle and manubrium of the sternum. Now let's jump into the landmarks of the clavicle. First of all, what is landmark? Landmarks are those structures which are consistently present in the tissue or bone. Now, what are the landmarks of the clavicle? The first landmark of the clavicle is the acromial facet. What is facet? Facet is the small smooth surface that serves as an articulate surface. So this one is acromial facet of the clavicle. The second one landmark of the clavicle is the sternal articular surface. The third one is the oval impression for costoclavicular ligament. The fourth one is the groove for subclavius muscle, where subclavius muscle attaches. Another landmark is conoid tubercle. Conoid tubercle provides an attachment site for the conoid ligament. It provides an attachment site for the conoid ligament. And last landmark of the clavicle bone is trapezoid line or ridge. The trapezoid line or ridge. This one is the trapezoid line or ridge, which provides an attachment site for the trapezoid ligament. Remember, all these landmarks are present on the inferior surface of the clavicle. So the landmarks of the clavicle which you have studied till now is the acromial facet on the acromial end of the clavicle, and the conoid tubercle for conoid ligament, trapezoid line or ridge for trapezoid ligament, and the subclavian groove for subclavius muscles, and the oval impression for the sternoclavicular ligament. Overall, 4 ligaments are related to clavicle bone. The acromioclavicular ligament, which supports the acromioclavicular joint, conoid ligament, and trapezoid ligament. Remember, the conoid ligament and trapezoid ligament are those ligaments which are formed between the coracoid process of the scapula and the acromial end of the clavicle. And the fourth one is the sternoclavicular ligament. Now, let's jump into the animation of these ligaments. This ligament is called acromioclavicular ligament, which supports the joint between the clavicle and the acromial process of the scapula. The second ligament is called trapezoid ligament. This ligament is formed between the trapezoid line or ridge, This is the trapezoid line or ridge on the inferior surface of the clavicle and the coracoid process of the scapula. This ligament is called trapezoid ligament, while this ligament is called the conoid ligament, which is attached between the conoid tubercle on the inferior surface of the clavicle and the coracoid process of the scapula. So, acromioclavicular ligament, trapezoid ligament, conoid ligament. The fourth and last ligament is the sternoclavicular ligament, which is attached between the sternal end of the clavicle and the manubrium of the sternum, and also the first costal cartilage. So this ligament is attached to 3 surfaces. That is first costal cartilage, manubrium of the sternum, and the sternal end of the clavicle. Overall, 6 muscles are related to clavicle. Remember, these muscles either take their origin from the clavicle bone or insert on the clavicle bone. Now, as you know that we have 2 parts of the clavicle bone, that is medial 2/3 part and lateral 1/3 part. To lateral 1/3 part, 2 muscles are related, that is deltoid and trapezius. While on the medial 2/3 part, 4 muscles are related, that is pectoralis major, sternohyoid, sternocleidomastoid, and subclavius. Now, pause the video and learn the names of all these muscles, because we are about to discuss the animations of all these muscles. This is the trapezius muscle. As you can see, the part of this muscle inserts on the posterior aspect of the clavicle. This is the posterior aspect of the clavicle where the trapezius muscle part inserts on the posterior aspect of this clavicle bone. So the first muscle which is related to clavicle is trapezius muscle, and specifically it is related to lateral 1/3 part of the clavicle, and more specifically it is related to the posterior aspect of the lateral 1/3 part of the clavicle bone. The trapezius muscle elevates the scapula, depresses the scapula, rotates the scapula, and also it retracts the scapula. The second muscle, which is related to the lateral aspect of the clavicle, is deltoid muscle. This is deltoid muscle. As you can see, the part of the deltoid take its origin from the lateral aspect of the clavicle. And it is from the anterior lateral 1/3 part of the clavicle. Also, the deltoid muscle take its origin from the spine of the scapula and acromion process of the scapula. While this deltoid muscle inserts on the deltoid tuberosity of humerus. This is deltoid tuberosity of humerus, where deltoid muscle inserts. Here we are observing the abduction of arm and shoulder joint from the posterior side. So, the acromial part of deltoid muscle, when contracts, it causes the abduction of arm and shoulder joint, or it causes the abduction of arm at the glenohumeral joint. That's how it causes the abduction of arm at glenohumeral joint. On the other hand, the clavicular part of deltoid muscle has got three actions. It performs medial rotation of arm. That's how it performs medial rotation of arm when it contracts. The clavicular part of deltoid muscle also causes transverse adduction of arm at shoulder joint. The clavicular part of deltoid also causes flexion of arm at shoulder joint, or it causes flexion of arm at glenohumeral joint. Now, subclavius muscle. Subclavius muscle inserts on the inferior surface of clavicle, and specifically it inserts on the subclavian groove of clavicle, while it takes its origin from costal end of first rib and adjacent first costal cartilage. The subclavius muscle helps stabilize and control the mobility of the clavicle during movements of the pectoral girdle, especially during elevation. Sternocleidomastoid muscle. Sternocleidomastoid muscles take its origin from two parts. It has two heads, that is sternal head or clavicular head. Its sternal head takes its origin from the manubrium of the sternum, while its clavicular head takes its origin from the superior surface of the clavicle. As I don't want to frustrate you, so that's why I have decided not to mention the action of sternocleidomastoid muscle, because the action of sternocleidomastoid muscle is a little bit complex, so let's skip it. Now, sternohyoid muscle. Sternohyoid muscle takes its origin from the posterior aspect of the manubrium of the sternum, and also it takes its origin from the posterior aspect of the medial part of the clavicle. The sternohyoid muscle depresses the hyoid bone after it has been elevated. So, sternohyoid muscles performs only one action. What action? The action is that it depresses the hyoid bone after it has been elevated. Pectoralis major muscle. This muscle inserts on the crest of greater tubercle of humerus. On the other hand, this muscle takes its origin from the anterior aspect of the medial half of the clavicle bone, as well as this muscle takes its origin from the manubrium of the sternum and the sternal body, as well as from the two ribs and their costal cartilages. Pectoralis major muscle also forms external oblique aponeurosis in the abdomen. Overall, there are 5 actions of pectoralis major muscles. The first action of pectoralis major muscle is that it causes transverse adduction of its shoulder joint, or it causes transverse adduction of arm. So that's how it causes transverse adduction at shoulder joint, or it causes adduction of arm. The second action of pectoralis major muscle is that it causes medial rotation of arm. That's how it causes the medial rotation of arm. The third action of pectoralis major muscle is that it causes shoulder flexion, or it causes flexion at shoulder joint, or it causes flexion of arm at shoulder joint. The fourth action of pectoralis major muscle is that it causes shoulder depression, or it causes lowering of the clavicle bone, scapula bone, and arm. Or in other words, it causes shoulder depression. The fifth and final action of pectoralis major muscle is that it causes the adduction of the whole arm. That's how it causes the adduction of the whole arm.